Welcome to the Dr. Truth Show with Dr. Michael Hall and Sophia. It is the 31st of August, Monday, and we are in Miami Beach, Florida. And today's topic is going to be about vaccines. And the reason why we're talking about vaccines is because vaccines are on everyone's mind right now because of the COVID vaccine that will be coming shortly per our health officials. In Washington, D.C., it was recently announced that Operation Warp Speed, which is the federal mandate to create a vaccine as soon as possible for COVID or SARS-CoV-2, that vaccine apparently by Moderna and other pharmacies and pharmaceutical organizations that are presently in this process are going to release something very soon. We don't know how soon, but they're talking about October, which would be 2 months from now. That would be quite interesting if that were the case. We do know that other countries are manufacturing vaccines, and one in particular is Russia. And that one has already been produced. In fact, they have 2 vaccines. And they've tested the vaccine on a number of people, I believe up to about 3,000. And they've had some minor side effects, fever and some irritation locally at the injection site. But we do not have any third-party validation of this, and we do not have the vaccine in America to test it and analyze it for its ability to robustly produce antibodies. So just a little history. Do you know anything about vaccines, Sophia?
Not exactly. I know that vaccines are meant to prevent a possible disease, but that's pretty much it.
That's good. The reason why I asked that question, most people have no idea what a vaccine is. They hear vaccine and they think something scary or spooky. They hear in the press that people can die from vaccines. The flu vaccine is one that people talk mainly about because they do know about it because they get it each year, or some do. The vaccines are really more or less a protein that's been produced, typically artificially, in a laboratory, in a pharmacy, typically in mass quantity, and formulated to be delivered to our immune system through a jab. So the material goes into the immune system via our bloodstream, and that protein then produces an antibody. It causes a mild sort of infection, if you will, stimulating the B lymphocytes, which are the antibody-producing lymphocytes, to create an antibody response. Then that antibody response, even though it's a limited amount of the material that the body's reacting to, it doesn't cause disease, but it causes an antibody reaction, and that antibody reaction then produces immunity. And immunity is simply the ability for the body to fight the disease. Now, in relationship to COVID, and I don't like using COVID as a term because it's very difficult to understand what we're dealing with when we say COVID. COVID implies a disease, and really SARS-CoV-2 produces a variety and high diversity of disease, meaning that some people are asymptomatic and have no disease whatsoever. Others can get quite ill and have respiratory problems or other issues with their immune system, maybe have a cytokine storm, which you've probably heard about in the news, have a hyperinflammatory response, and then have more problem. So COVID is really not the best description for what we're dealing with. What we're really trying to get across to people, and I think most of our audience would have to agree with that, SARS-CoV-2 is an infection that we presume to be manufactured in a lab. Most scientists are in agreement. Most scientists, when I say most, we're talking about leading scientists. Francis Boyle, being a scientist, lawyer, wrote the Treaty on Bioweapons Use for the United States government. The main researcher for HIV in France. A number of researchers and scientists, virologists, believe that this was a manufactured virus, that this virus didn't come from a soup, that was made from bats. This came from a lab that used the coronavirus as a gain of function. It took the coronavirus because it's a common virus, that's a cold virus, and reprogrammed it with different aspects of other virus particles and delivery systems of other viral particles. And that we'll get into maybe in another discussion. But this particular virus is highly infectious. It moves about in the air, easily transmitted from person to person, and creates a myriad of reactions. And as I mentioned, some people are asymptomatic and would never know they had the infection. Others become highly disturbed by the infection, become very lethargic and weak, tired. They become breathless, they become incapacitated, and some die. Typically, the number of deaths that we're seeing from this are mainly in people over the age of 70 and that have health concerns, have hypertension, diabetes, maybe cancer, and already have a weakened immune system. People that live in nursing homes, that don't get out, that don't have adequate diets, vitamin D, vitamin C, zinc, those types of things. So that's what we're dealing with. So producing a vaccine to protect people that don't get sick is something that we typically don't do. The second point would be to bring up the idea that a vaccine can be dangerous if it's not studied appropriately. Now, how they took a virus that was new and novel, meaning that it hadn't been introduced into the world, and this is in December, late November, early December, and then now we're talking about October, so 9-10 months from the infection point until now, we have created a pandemic that seems to have escaped China and now is floating around the world. It's affected almost the entire world, and the vast majority of people don't get sick. The vast majority of people are typically very healthy, even with the virus. And then for whatever reason, we don't know this, there are different studies that indicate why some might get sick over others. But the point is, some very small percent, we're talking about percents that are less than actually what caused the flu death each year. Because there's just so many asymptomatic cases, we really don't know, but it's less than 0.001% of people apparently that are dying from the infection from SARS-CoV-2. And they tend to be much older people, as I mentioned. So younger people are going to get the vaccine. And the vaccine is going to be given in some places in the world under mandatory law. So we're talking about those that get the vaccine that are young, that have not had infection, that has demonstrated symptoms. So we're going to talk about asymptomatic carriers that will probably be vaccinated for most school attendance and possibly even to work or to travel. Those that will be vaccinated will then have a protein, a messenger RNA strain of protein that will be given as a vaccine. That's the presumed protein, since it's a messenger RNA virus. That will then incite an immune response. That immune response will then create antibodies, and we're not sure how many, we're not sure how long, but antibodies will be produced. We anticipate that there'll be some safety profile for the vaccine, that if you do take it, minimal side effects could be expected. And then the question is, does that confer immunity? If you get the vaccine, will that produce enough immunity to prevent the infection? Could it prevent the infection across the board from the different mutations, or will that only affect one particular segment of the viral population? We don't know that. There's a presumed number of 150 different mutations currently that we're aware of. Of those vaccine companies, those different labs making the vaccine particle, the protein, we don't know if they're targeting different mutations or they're targeting different strains. There's the L strain, there's the S strain, which are two different strains that came from two different parts of the world. But the real question is, will this produce immunity? And the second part of that question will be, could it cause an immune response that could cause a problem if someone were to encounter SARS-CoV-2 at some other point in the future after they receive the vaccine? So will they become immune, or will they have a reaction if they do encounter the virus at some point and trigger a cytokine storm? Now that's a possibility, because that has happened previously in other tests that were done on previous vaccines with ferrets, with animals that are very similar to the human immune response. In that particular marsupial, the ferret was given a vaccine that was produced for spike protein, which SARS-CoV-1 is, and SARS-CoV-2. SARS-CoV-1 existed at that time, and that's what they were trying to produce a vaccine for. SARS-CoV-2 is more or less similar structure, but has different proteins in it, as I mentioned before. So the main thrust of this discussion would be really to enlighten the audience to understand that vaccines are not necessarily very easy to make, so that having a quick and dirty vaccine, so to speak, with Operation or Warp Speed is a little bit beyond my understanding. I'm not sure how they could do this. They seem to have now gone to human testing pretty rapidly. So Operation Warp Speed now will lead us to a vaccine in October, and that vaccine will then presumably be given to older people initially, and to first-line healthcare workers. That will be done in America. As we mentioned before, we know that there's a Russian vaccine that's being given. We don't know to whom, but it has been produced, and apparently it is currently being utilized in the population of healthcare workers in Russia. And China has now recently released one of their vaccines, and there's some protocol that they've mandated for the use of that vaccine. So now to take the discussion to the end point, and what I think is important, and I'll ask Sophia this, are you willing to take a vaccine that may not have been fully safety tested? Would you be able to do that, Sophia?
No, I wouldn't.
Well, there you have it. That's going to be the million-dollar question. Are people going to feel comfortable taking a vaccine that has not been fully safety tested, and that has been made very rapidly by drug companies, pharmaceutical companies, labs that want to make a lot of money? So I'll leave you with that thought. Is there money driving this, or is it really about protecting people's health? Probably a bit of both. So we'll leave the discussion. And always, if you have questions or comments, please contact the clinic at clinic@halllongevity.com, or you can call us at 305-672-4733. And you can reach us through the website, www.halllongevity.com. We thank you for listening.